I'm Dr. Giedt, and this is Patti. We're here to talk about tampons today.
We get a lot of questions about tampons, and different people are embarrassed sometimes to ask, so we figured we'd just touch base on those. One of the frequent questions is it okay to wear tampons all day long?
Yeah, it's okay to wear a tampon all day long as long as you're changing them frequently. And I would say changing your tampon every 4 hours or so would be a good goal to have.
Okay. And what happens if you forget and you leave a tampon in for any length of time? I mean, is there risk of infection, or why do they want you to change? And besides, obviously, them not protecting you.
There is a risk of getting infections for keeping your tampons in longer. So I would try to take your tampons out at least every 8 hours. And if you forget to remove your tampon, then I would just try to remove it as soon as possible.
What would be like signs that like if you can't feel the strings and you're not sure, what would be signs that maybe it is lodged up in you, and can it go anywhere, or what happens to it?
Usually the tampon, if you did forget to remove it and it does become dislodged, it will be at the top of the vagina. So it'll still be in the vagina, but you just can't feel the strings. And some symptoms that you would have would be discharge, foul odor, sometimes some abdominal pressure or discomfort. And if you did think that there was a tampon, I would just really try to insert your fingers in the vagina and try to remove it. And if you're unable to do that, then you just make an appointment at our office and we can help with that situation.
Okay. Is a retained tampon, is that what causes toxic shock?
You know, keeping a tampon in for longer periods, sometimes more than 8 hours, can increase the chances of toxic shock syndrome. And what can happen with that is that there's a certain bacteria that releases toxins in your system, and if that bacteria does that, it can cause things like muscle aches, nausea, vomiting, diarrhea, feeling faint, passing out, and having a rash that looks kind of like a sunburn. So if you had those symptoms, we'd want you to head into the hospital right away.
Okay. Is it becoming, I know they you see it on the packaging, is it becoming less frequent, the toxic shock?
Yeah, there's probably less than like a 1 in 100,000 chance that that would happen to someone. But it is associated with tampons and using higher absorbency tampons for longer periods.
Okay. But overall, tampons are safe?
Yes.